This is Haiti Merritt with Insulin Nation. We're here today at the Joslin Diabetes Innovation Summit 2012 in Arlington, Virginia. And I'm here today with John Brooks, who is the CEO and president of Joslin.
Thank you for the invite. I'm delighted that you're here, and we're delighted that we're putting on this really what we think is going to be demonstrable, very innovative, and very exciting conference. So yeah, we've had a lot of small programs before, but this was the first time we really decided let's put on a big program, because frankly this disease needs a lot of focus, needs a lot of attention, needs a lot of energy, and let's do it here in Washington to really capitalize on the fact that, again, we have a national pandemic. And we wanted to make sure we could get all the thought leaders, government officials, and others to really convene so we can actually do something about it.
I agree. It really gives it clout having it down here in the nation's capital.
Exactly.
Right.
So far, we've already had a number of great speakers. And again, the beauty is we can get, people that are actually in government helping to put programs in place, and they need to hear our ideas. And we also want to hear what are they doing, what's going on with our federal government and across the state, across the country, as we think about, really putting a dent in what clearly is a major disease for the United States and the globe.
It's huge, yep. Okay, well, let me start with the first question. What is your greatest aspiration in pairing technology with healthcare?
Yeah, so we have a concept called Joslin Everywhere, and the whole idea is we know we have a lot of great people at Joslin, and frankly, there are other great people across the country. But how do we take care of 26 million people in the U.S. with diabetes? We know they're not going to come to Joslin. We don't have the room, and that's really not practical.
Mecca.
So, right. So how do we use, to your point, technology, innovation, connectivity, mobile phones? So the whole idea is let's think about ways we can really leverage the expertise, whether it's telecommunication companies, people that are coming up with new apps, new technologies, new approaches. How do we really use that so we can take our expertise and deliver it to patients, deliver it to their families? Because one thing we know about diabetes, it's a self-management disease.
Yes.
So the more we can really empower people to use the type of information we can provide them, we can take all the information as they're checking their blood sugars.
Yep.
Let's get it in the cloud, let's analyze it, and then let's give them some information back that says, you know what, here's what we're noticing. Let's see if we can make some mid-course corrections. I use the term, why do we want to wait, every 90 days in between visits and say, well, there's things going on, but we have to wait for your next visit before we're going to do something about it. If we know there's something not quite right, let's change it on the fly.
Right, that's great. I totally agree. Now, the catchphrase for this conference is be considered part of the solution. What does that mean to you?
Right, so what it means is, look, this is a huge problem. 26 million Americans, as I've already indicated. You can multiply that number by 3 in terms of what the risk factor is.
Right.
In terms of obesity, in terms of people that basically are pre-diabetic or risk for being diabetic. So, huge problem. So the real answer is, what are we going to do about it? We have to move beyond the talking stage. We have to move to what are we going to do?
Right.
So we love to do pilots. We like to try things. We like to experiment. We use the word collaboratories, which means let's try things.
Right.
I don't have to know what the outcome is. I don't have to know what the answer is, but I know if I do it and I do it with others, we're going to find a way to make a difference.
Right.
To make
We
an
need
impact.
to be proactive, and things need to change.
Exactly.
Yeah.
So it's all about, let's go from the talking stage to the doing stage.
Right. And
that's going to make an impact.
Right. And that kind of leads into the next question. Dennis Urbaniak from Santa Fe says that we're here as collaborators and not as constituencies. Do you think that that is going to be successful?
Yeah, it really is. That's what we basically focus on. Our strategic plan at Joslin, the first words in it talks about collaborating.
Right.
Because we can't do this alone.
No.
This is a huge problem. But if we can catalyze it, if we're the ones that kind of create a little bit of a spark, a little bit of an interest, but if we can leverage the expertise that industry has, if we can leverage the expertise of different players, if you will, across the country, we can get insurers, we can get employees, we can get, basically healthcare plans. It doesn't matter. But if we can galvanize and energize and get everybody thinking about how we can work together and, make an impact, that's really the way we're going to do it. This isn't going to be a handful of us kind of thinking we're going to make a big difference.
Well, it's really
collectively
refreshing.
We can.
That's refreshing to hear. I think that's a great new attitude.
That's the way it's going to work.
Yeah,
that's
great.
Exactly.
Okay, final question. Can you put these in order of importance to you?
It's interesting. So I could.
They're all very important.
Right. So I'm going to start off with patient provider. Primarily because patients have to be at the beginning of everything we do.
Nice.
I think we also know community-based. Diabetes is a family disease, and we also know that it's very different as we think about different ethnic, cultural aspects. And frankly, people are out in the community, they're working in their environment, they're working with friends and all. So we need to make sure that what we're doing is really not letting people come into the hospital. We want to let them continue to be productive, live great lives, be productive members of their community, and that's why community makes sense. And then lastly, as I mentioned, technology is important. Again, our job is to make sure we help patients and their families understand what it is about their disease that they're managing themselves, and can we really use the power of cell phones, apps, cloud-based technologies, data analytics, all the things we heard from Todd Park and others. The way we're going to get there is basically take a big problem called diabetes and break it down into smaller actionable items that we can help primary care doctors, patients, families, anybody involved. We can actually start solving it and making real differences.
That's great. That's very good. Thank you.
You're welcome.